In this video, I'm going to talk a little bit about how modern psychiatry and some of the heavily controlled fields in the medical industry like psychologists and psychiatrists, how they come into play when interacting with someone who is a targeted person or targeted individual. And if you have ever been to one of these doctors and complained about having symptoms of noticing or observing what seems like people telling you, following you, or giving you an excessive amount of attention that you don't feel that you've in any way initiated for any valid reason, one of the standard responses, and unless they're not going along with the main line of thinking in these fields, one of the standard responses is to label you with a diagnosis that is going under the assumption that that you fit the description of someone who would be known as either mentally imbalanced, or that you are somehow schizophrenic, or you've got some kind of disorder. And usually there's two main diagnoses that get handed out to targeted individuals who complain to doctors. If you're close to my age, and I'm 28, if you're around my age, you may be, most of the time, once you get past right around your mid-20s, say 26 or somewhere in that range, you've gotten past the point where you're likely to be diagnosed as schizophrenic. You will probably receive a diagnosis of delusional disorder. If you are younger than this age, you're likely to receive some kind of schizophrenic diagnosis, and of course there's different sub-diagnoses that you can get under those umbrella terms, and but oftentimes, and the majority of the time, you're going to get one of these two, and standard treatment for either one of these is nothing short of an atrocity. The medical industry certainly is going to profit off of you, or attempt to, at least, as long as they can. And if you do find yourself in front of a doctor like this, and for some reason you've let's say that you've already been going to a psychiatrist and before any of this started, and you have appointments that you want to go to because you've maybe paid in advance, or you want to fulfill your obligation, it's highly recommended that you be careful what you say to them, because certain things will immediately be termed under different diagnoses. And above that, though, it's even more advised that you don't see these doctors at all for this particular complaint. The entire reason that I'm making this video on this topic is that in a lot of ways, modern psychiatry and psychology is working as a gatekeeper for this for this program and for similar programs like it. And this does not mean that the doctor that you're talking to is aware of this. They are just practicing what they've been told by the book. And there may be people who genuinely do have some kind of disorder or imbalance, but most of the time, and in cases with people who are targeted, 100% of the time you will be misdiagnosed. And when this happens, the main purpose of this happening is for you to it's a twofold purpose. One is that you're discredited because you've been labeled, and secondly, you are going to be medicated most likely. So this is going to affect you in numerous ways. Most of the medication they give out is high it's high in fluoride, and if you've done any research on things like Prozac, it's about 94% fluoride, which is in no way good for you. So definitely avoid this whole area, because in a lot of ways this is being used to gatekeep for the whole gangstalking thing. So just make sure that if you do ever go to see someone like this, that you keep this in mind, and don't let yourself get improperly branded. Don't let yourself get improperly medicated.